Okay.
I mean,
Good evening, distinguished scholars.
Good evening.
Ladies and gentlemen from across West Africa, particularly Ghana and Nigeria. We welcome you to this program. I'm Dr. Tony Aniagu, and I'm a moderator for this week, the week 1 of the D43 Spark Train program. Spark Train is Sickle Pan-Africa Research Consortium training. And this particular training that we are doing on sickle cell disease genetic counseling is one of the trainings. And so I want to welcome Professor Priska Adejumo, who is the NPI for this particular training, to welcome us on behalf of the PI herself and all the organizers. Professor Adejumo, ma'am.
Okay, thank you very much. We are just 52, so I'm wondering if we can try and get other people to join so that we will not start, and then when the lecture starts, we'll not start looking for them. Then I want to find out if our speaker is in. So as we continue all of this discussion, we can please make sure that we get a speaker. Okay, so I would like to just say a very big welcome to everyone. We're all greatly appreciated, and we thank God for making it possible for us to be here tonight and commence this second batch. Like Dr. Aniagu has said, but we have different group of people that have been interacting with us. For tonight, we have been told that Dr. Oluwatoyin Aniagu is a moderator, and we'll be coming across several other moderators in the course of this 1 month. And I want to say this grant is a 5-year grant. And I have in the house tonight, Dr. Ofakorin and myself, and Professor Ojengbede, Professor Obiageli Nodu, who is the contact PI, and a number of other people, Professor Safo, and so on and so forth. So we have PIs, we have co-PIs. It's a multiple PI grant, meaning that we have about 4 of us as the PIs on the grant. And the contact PI, like I've said, is Professor Obiageli Nodu. We also have 3 program managers that are manning 3 different sites. We have Mr. Hello, we have started. Who is speaking, please? We have Mr. Aaron.
Please mute your microphone.
Ghana. We have Mr. Shola for Ibadan, and we have Madam Ijoma for Abuja. So these 3 program managers are the life wire of this grant, and they are the ones who are responsible for directing and leading. And if you need anything for housekeeping, you need anything whatsoever, depending on where you are coming from, whether it is Abuja or it is Ibadan or it is Ghana, then the program managers are the ones that you are going to, be connecting with. This aspect that we are doing is just one of the 5 different aspects that the grant is focusing on. This one is the genetic counseling part. The aim is not to make us genetic counselors, no, but it's to expose us to general overview of what genetic counseling is all about. There are different aspects of genetic counseling, but almost all non-communicable diseases. Okay. All non-communicable diseases, whether it's cancer or whether it's cardiovascular issue, whether it's sickle cell disease, whatsoever, they all have genetic counseling, and the pathway is the same. But for the purpose of this grant, we are focusing on sickle cell disease. And we're going to be talking a lot about sickle cell disease, our overview. We're going to talk about epidemiology. We're going to be looking at signs and symptoms. We're going to be looking at how to, deal and manage and care for the people. But in all of them, the stream, one track that cut across them all is genetic counseling. So that if you're talking about sickle cell disease individuals or patients, how do we ensure that we are giving unto them current and correct information? How do we ensure we avoid misinformation? How do we make sure that we give them information that we help them to make an informed decision? So we're going to be talking a lot about that in the course of this 1 month. And of course, at the end of this 1 month, we are going to have a 2 weeks hands-on. That 2 weeks hands-on is going to be in our various sites. So if you're in Ibadan, it will be in Ibadan. And Mr. Shola, Mr. Victor, Dr. Kotila, and Dr. Anyagu are going to be in charge with Mr. Abayomi. They will be the ones that will help us to chaperone that. We are going to have Mr. Aaron primarily in Ghana, and Madam Ijoma and Professor Obiageli Onodo in Abuja. So the most important thing for me is to say that we should please participate and make the very best use of this opportunity that we have. We have so many people, but we want to make sure that those who truly are in need of this are those who are participating. Now we know that quite a number of people have dropped off, which is fantastic. With the fewer, the better. I also want to like to mention that please take note. This training, it is not because we want to distribute money. No, it's because we have agreed that we want to refund the amount of money that we spent for data. It's not because we are distributing money. No, I just want us to get that very clear. We are giving back some part of the money that we spent for data in the course of this one month and 2 weeks for hands-on. So it's important for us to take note of this. And please, there is nobody who is going to be responsible for distributing money to anybody. There was a lot of stress concerning that in the first batch. And as much as possible, we want to avoid that. Please let us take note that attendance, 100% attendance is compulsory. So that at the end, if you participate and you did not participate throughout, and you are not qualified to be able to get the reimbursement, then it's nobody's to be blamed, it's you. So attendance is compulsory. It is 8 p.m. to 10 p.m. every Friday night like we have today. And tomorrow, Saturday, is 7 a.m. in the morning to 9 a.m. So it is important that we make ourselves available. What do you say? Is somebody talking with me? Please, can we mute all? Can you mute all
participants? Mute your microphones.
No, mute all. Is that?
I've done that, man.
Okay, thank you for muting all. So
I've done that, man.
So it's very important for us to know that as participants, there are rules and regulations that guide our involvement in this.
Prof, we can't hear you again. Okay, while we are waiting for Prof to come back. Okay.
Can you hear me now?
You can hear you now.
Okay, I'll soon be rounding up. I just want to say there are two important activities for tonight. One, pre-test, and two, evaluation. They are not the same thing. Please take note. If you do evaluation and you don't do pre-test, you have not participated. So it is important to do pre-test and do pre-evaluation. Take note of those two different activities so I don't mix them up. Don't let me waste too much of your time. But my assignment is just to say a very big welcome to you and to appreciate you for being part of us. And I wish us all the best in the next 2 hours or so. Thank you very much for having me. On behalf of all the principal investigators and the co-investigator, thank you. Good night. Thank you. Welcome and God bless.
Thank you very much, Ma.
Thank you.
Professor Priska Adejumo, the PI for this particular training. I will have asked us to put our hands together, but I want to assure you, Ma, that we are clapping. Thank you very much, Ma. We were able to do the first training successfully, and so we still trust God that He will help us with the second batch of the training for 2025. Remember, as she said, that it's a yearly program that's expected to last for 5 years, and this is only for 2025. We had 2 batches this year because we had so many people that registered in the first batch, and we couldn't take all at the same time. That's why we had to split to first and second batch. As from next year, it's going to be only 1 batch per year. Thank you very much, Ma. Now, coming to the pretest, it is very important that you do your pretest today. It is very important. And Prof, Ma, if you allow us, we were thinking that we should move the pre-evaluation to tomorrow so that there won't be any confusion with pretest. Some people will do only the pre-evaluation and will not do the pretest. And at the end of the day, they will not be qualified to write the post-test. So it is important for you to do the pretest when the link is dropped in the chat box. Tonight, we will make use of the chat box for both the link and our question and answers. But please listen attentively to the expert that will be speaking tonight. It's important that you listen and let your question come in towards the end. He's going to spend 40 minutes to speak to us, and towards the end, drop your questions in the chat box. Henceforth, we'll be putting our questions in the Q&A platform on the Zoom later. But for tonight, we are using the chat box. And later on, there's going to be the attendance in the poll. So it's important for you to be on the lookout for the attendance. The poll will be dropped and the attendance will be dropped on it. Please fill in your attendance. Just like Professor Priska said, 100% attendance is important. If you miss one day, you may not be eligible. And if you are not eligible, you won't write the posters. And if you do not write the posters, you may not be eligible for the hands-on again. The hands-on will be looking at very outstanding participants in the 3 sites who will then go ahead to do the 2 weeks hands-on training covering laboratory appreciation and genetic counseling in sickle cell disease practicum. It is very important for you to pay attention and to make sure that you sign your attendance every time, Fridays, Saturdays. Take note that Fridays are 8 to 10. Saturdays are 7 to 9. But in Ghana, it is 7 to 9 on Fridays and 6 a.m. to 8 a.m. because of the time difference that we have. So on this note, I'm going to call on one of the program managers to handle the pretest. Please call on your friends that are registered. We are expecting about 300 people and we are 110 now. Please let everyone who are registered come in now so that we can partake in the pretest before we have the first speaker take the lecture tonight. Miss Ijoma, are you in the house? Madam Ijoma? Mr. Shola, Mr. Aaron, are we prepared for the
hello.
pretest? Okay, so maybe while we are
Yeah,
doing that,
yes,
please be
yes.
taking, we are prepared. Okay, so while we are doing the preparation
Yes.
in the next 2 minutes, we may want to take, we would like to take 1 or 2 persons to tell us what the expectation of this training is in the next 3 minutes. In the next 3 minutes, can we have 1 or 2 persons? Please raise your hand so we can be unmuted. What are you expecting from this training? How do you think this training will meet your needs? Remember, the professor has told us that it is not to make a genetic counselor in us. It's not to turn us to a genetic counselor, no, specifically genetic counselor, but for us to have an idea of what it is and for us to be able to handle cases that come our way when we work in the clinics, in our various departments and institutions. It is not the training to turn us to genetic counselor. But what are you expecting? Can we have 2 people from Ghana and Nigeria?
Hello, Dr. Niagu. So the link is being shared at the chat box. So
Okay.
all the participants, yes, can
should
check
go there
the chat box. Yes,
and
please.
check. Okay, thank you very much, Mr. Aaron. That's one of our program managers and he's particularly from Ghana. Please go to the platforms, the WhatsApp, and click on the link to do your pre-test.
Yes,
The
and
link is also on the chat box.
yes, they have 45 minutes to complete everything. And there is a timer, so they should make sure they are able to work within that time. Other than that,
Okay.
the link will be closed.
Okay. Please leave all the questions to the end, towards the end of this session. I can see OS asking a question about tokens. Please, if you are part of the first training, please don't come in this second one. And if you do, we have a mechanism to remove you. This one is for people who are on the waiting list, who have not participated at all. So if you have done the first training and you are still on this second one, be sure that it will be removed. So anyone asking question about token is not for this particular session. Any question regarding this session should be towards the end of tonight, so your questions will be answered. The pre-test link is dropped both on the chat box and on the platform. Mr. Aaron, they are saying that the document is not published. Please go ahead and publish
For
it so
people
we
that
can view
just
it.
joined, they might not be able to see it.
Okay.
So he'll keep, dropping it for still joining. People are still joining, so that he keeps dropping it for them to see.
We have to. Pretest is not about answering perfectly the question. It's just to know, have an idea of what knowledge you have about this. It's not for you to score. In fact, if you score 100%, then you are not supposed to be here. Please just do what you can do. And let's start with the training. What matters is the post-test, but it's important that you also do the pre-test so we can compare at the end of the training. Thank you. I want to believe that people are already on their pre-test by now.
People are still joining.
Okay, as people are joining, please go to the chat box or to the WhatsApp platform and click on the link for pre-test. This is the time to do your pre-test, not tomorrow. We also want to use this time
this
to
document
welcome.
is not published, so that's what they're saying.
Mr. Aaron, please attend to that. Mr. Aaron, Madam Ijoma, Mr. Shola, please help us attend to that. Let the document be published so everyone can have access. Thank you. This is 18 minutes past 8 in Nigeria. We should be 18 minutes past 7 in Ghana. And so we are on pre-test now. And the pre-test is supposed to take 30 minutes. If we start now, we should be finishing by 8:48 or thereabouts.
Seeing the document is not published.
It's not published. Mr. Aaron, are you checking?
For people that are just joining, they might not be able to see it.
Okay.
If they are just joining, they won't see it.
No, we joined at the beginning, okay. Except we join again.
Okay.
No, don't join. Don't go out now and come in again.
We join at the beginning, but it's saying document is not.
I've sent it again. Please go back to the chat.
It's about sending it, and it's not about joining late. We are able to access
Madam,
the
go
link.
back. It's there on the chat. I just dropped it on the chat now.
It's not about the chat. It's about the link. When we open it, it's giving that not published.
It's still saying.
Okay.
Somebody is working on it, I'm sure.
Just calm down. Dr. Anya, can you try it?
Please, what Madam is saying is true. When you open, you can only enter your name. They said it's not public.
Just calm down. Dr. Nyago, can you try it while I keep?
Yes, I'm doing that now. I've entered my name. And I've clicked on start. Okay, the document is not published yet. Mr. Aaron, please, can you attend to that? Mr. Aaron, Madam Ijoma.
Yeah, so kindly give us some few seconds, okay?
All right, thank you very much. Okay, so while we're waiting for that, can we listen to one person from Ghana and another from Nigeria, and what your expectations are. Please unmute and speak. I want to assure you that in the next few minutes, we'll be able to do the pretest. But while waiting, let's listen to what we are expecting in these 4 weeks of virtual interactions. What are we expecting?
Good evening, Mass. Dr. Aniago.
Yes,
and
ma'am.
all coordinators. We want to appreciate you for this opportunity that you are giving unto us. At the end of the training, I personally will want to know how to do genetic counseling, especially for those who the younger ones and those who are about to get married, so that the rate of sickle cell will be reduced in our society. This has been my concern, because each time I see under 5 having sickle cell disease is a kind of burden to me. So I'll be able to help, especially those within my vicinity, the organization where I work, my church, my local government, and so on and so forth. Thank you so much, Ma.
Thank you very much, Mama Uluwemida. Thank you so much, Ma, for these expectations that you have shared with us. I'm sure your expectations have been noted. There are experts that are coming to speak about different aspects, as highlighted by Professor Adejumo earlier, and particularly regarding community participation, community involvement, the role of the community in all of this. So please be attentive and look forward to all the sessions that we'll be having in these 4 weeks. Thank you, Ma. Can we have someone from Ghana? Can we have someone from Ghana? Or someone from Abuja? Someone from the Southwest has spoken.
I'm from Kano, which is Abuja.
Thank you very much. What you saying?
Yeah, my name is Awal Gambo. Actually, I've been working on sickle cell for the past 12 years, I could say, on clinical trial. And my anticipation, expectation for this forum is that at the end of the discussion, it will enlighten us more on the implications of sickle cell, especially as it relates to families, and as well as give us better understanding of how we are going to relate. And then it will boost our also empathic approach to how we talk to the caregivers, the parents, as well as even the children. The children. Also, from another perspective, we know that marriage is usually a very complicating issue, especially when it comes to affections. You find it very difficult when you tell the couples to be married that one of them is all the two of them are AS, and then they find it difficult to accept that is going to be a difficult marriage for them. So this will also, through this session, we'll be able to come up with strategies that will allow us to see inward. How are we going to look at the challenges in convincing the couples against the norms that they're in love, they have to get married, not looking at the scientific aspect as well. Thank you.
Thank you very much, Awa Gambo. I don't know the appellation, but thank you so much for this, your submission. It's going to be a very rewarding time, on the program within 4 weeks to be able to achieve this. I want to assure you. And please look forward to this time. Be here every time. Make sure that your attendance is filled and you do all that you are to do. We have an array of experts and specialists cutting across all aspects to speak to us and to open our, widen our horizons on what we have known before or what we are doing right now. I can only see only one hand up again. I don't know if this person, Adegoke Adebayo, is from Abuja zone.
No, ma, I'm from Ibadan zone, no, University of Ibadan.
Oh, okay. All right, I don't want it to be skewed. That's why I want to go to Abuja zone. But since this is the only hand I'm seeing up, all right, you are on now. You can speak, and that will be the last one we will take tonight, so we can go to pretest quickly. All right, sir.
All right, thank you. I really appreciate this privilege. What I expect in this training, I expect core knowledge in sickle cell disease, to understand the biology, genetics, and inheritance pattern of sickle cell and related disorder, and two, to understand the principle and the practice of genetic counseling, for basically to know much about the genotype compatibility like AA, AS, SS, AC, and etc. in a clear and non-technical language to an individual and families. And what I also expect is, I know that because this is coming from academics angle, I know it's interdisciplinary and interprofessional training. So I expect, to see physicians, psychologists, nurses, and every other profession, and to expose to how different professionals contribute to sickle cell disease management and patient support. And again, I look forward to the training, the conduct of research on SCD and related condition. Thank you very much.
Thank you very much. I want to believe it's Dr. Adegoke Adebayo I'm speaking with. This is highly taken note of, and we've also considered all this. You will see as time goes on that we have a multidisciplinary gathering here, and it's going to be interdisciplinary as well, because one person cannot take care of the issues revolving around sickle cell disease. So we have an array of professionals cutting across psychology, public health, nursing. You have physicians, we have pharmacists, we have public health specialists, we have laboratory scientists, because we'll be talking about diagnosis, we'll be talking about pathogenesis, we'll be talking about the issues as it affects our environment, especially our continent on the side of the West. So we want to assure you that you are in for a time of fulfilling what you are willing to, desiring to see. So thank you very much. I want to thank everyone again who have waited patiently. We are 135 now in the house. And so we'll call on the program managers to let's have the link again so we can do the pretest. We should be done by 9 p.m. so that the expert that is ready to speak to us, Dr. Hezekia Issa, can come on. And please take note that by tomorrow morning, 7 a.m. in Nigeria, 6 a.m. in Ghana, we will come together again, and then we will put the link for the pre-evaluation program evaluation for every one of us to let us know what we are expecting, how we are expecting it to be done, and everything about the training per individual. It's not only these 3 people that are spoken. Everybody will also speak their own mind, but let it be tomorrow so we don't have any confusion regarding the pretest. Mr. Aaron, are we good to go now? Somebody is writing on the screen. Please, let's be careful so that by the time the speaker starts, we will not be distorting his screen. Thank you. Mr. Aaron, are we good to go? All the people that are asking to be added to the WhatsApp, we will do that. Just be patient, because this is the first session we are having, and some people just joined today. They just registered today. So we're going to be doing all of those. Everybody will be added to the WhatsApp. So we continue our communication over there. So please be patient. Thank you very much as you do that. Mr. Shola, are you working with Mr. Aaron? Okay, while we're waiting for Mr. Aaron to speak to us, I want us to also know that these sites cover 3 universities, 2 in Nigeria, the University of Abuja in Abuja and the University of Ibadan in Ibadan, which also represent the Southwest, and Abuja, which covers other area of Nigeria, especially up north. And then we have the Kwame Nkrumah University of Science and Technology in Ghana, where people have been drafted for this training. So all these 3 sites will be working together with their program managers. Mr. Aaron is from Ghana, as said by Professor Adejumo. Mrs. Madam Ijoma is from Abuja, and she'll be communicating a lot with people from around that zone, while Mr. Shola is from Ibadan, and he will be interacting with people from Ibadan and its environ. This is to make logistics easier. That's why we have 3 program managers. Now, are we ready? Okay, so it's working now. Please log in. Log in. This is 8:32. By 9, we are going to stop so the speaker can come on. Everyone, please log in. Can you please post the link again to the chat box, especially for people who are not on the WhatsApp? And if you're on the WhatsApp platform, please go there and log in now. Thank you. All right, the link is now on the chat box. Everybody, please go on to do the pretest. It is very important that you do the pretest. If you don't do the pretest and you now do the post-test, it's not going to count. Please do the pretest so that your post-test will count. The post-test will come at the end of the 4 weeks. That is September 27th, by the grace of God. Please do the pretest and do it now. Don't bother about the WhatsApp now. Check the chat box. The pretest link is on the chat box. You can access it now. It has been posted several times. Access the link on the chat box if you are not on the WhatsApp. And please do it now. I want to believe everybody's on the pretest now. The clock is ticking. We are going to be stopping a few minutes before 9 so as to allow the speaker come on. Remember, the pretest is not for you to pass and be extraordinary. Do whatever you can do and please submit. Make sure you hit the submit button. Some people will do it and not submit. Please submit when you are done. The scores that really, really matter is the post-test. Can everybody access the link?
Mr.
No, I did not
Aaron, please repost the link as if it's the old one I reposted. Repost the new one, please.
Okay.
Mr. Aaron.
Repost the new one, please.
Yeah, so it is the same link we are using, but it has
Same
been.
link.
Okay, but some
Okay.
people are saying that it's not opening. Please repost
Really?
for them as well. Repost for them, please.
Oh, okay.
They say it's not opening.
It is now opening. They should hit on the same link.
Maybe it's network on their own side, but just post it for them, please. Just post it for them. Just post
Please,
it
if
up
your
to like
network
3 or 4 times.
is not cooperating, please relocate. Maybe you should shift positions. Sometimes it works.
Just post it severally.
Repeat test you.
The link has been posted again by Mr. Aaron. Please try to access the pretest now.
Check on that. Look at pictures.
I believe that everyone is on the pretest now. I have tried it. It opened. If it's not opening still, please change your location. Change your position. Maybe it is network issues. And note that we have less than 20 minutes to do that. Dr. Kereke, please keep admitting people. New people are still joining.
All right. I was trying to repost that pre-test for people that keep saying they don't see it.
Thank you very much.
But I'm admitting those people.
All right. I can see that people are dropping off. Maybe it's network.
There's somebody that I don't know, you keep admitting her, you keep seeing her coming back. I don't know whether it's network or the person is just intentionally and deliberately leaving and coming back.
I want to use this time to thank Dr. Hezekia Issa, who has joined us since and is waiting to start his session at 9. Thank you very much, sir. We will introduce you when it is 9 p.m. and you will have the floor. Thank you.
Agasheka. Lafiya lau. Ba gajiya. Alhamdulillah.
Please mute your microphone. Thank you.
Ina wani Zoom ne, ina Zoom. Sai 10
Mute your microphone. Hey, mute, I beg.
Or please just mute everybody for now.
Okay, to shi kenan. Yawwa da jazakallahu khair.
Mr. Aaron, keep posting the pre-test link. More people are joining. so they can also have it and access it before we start the lecture for tonight. Mr. Aaron, please attend to the new challenge with the pretest. Next icon function is not functioning. It's not moving to the next page. Please attend to it now. Thank you. Please, let's make sure that we have good connectivity to last us these 2 hours on Fridays and Saturdays. I can see many people going in and out, and I'm sure that is because of is what their connectivity is doing. Please, let's switch to other devices or other means of strong network.
Inform is always going and coming. Inform.
We have about 10 minutes for the pretest. Please, let's hasten up and make sure that it is submitted. You newly joined, please click on the pre-test link, which is posted on the chat box and on the WhatsApp platform. If you are not on the WhatsApp platform yet, go to the chat box, click on the pre-test link and do the pre-test. Make sure you submit, please. It's very important. We have about 8 minutes. The link is being posted several times. Please try it. Keep trying it. It will work. The evaluation form will be posted tomorrow because we don't have time now. We have a few minutes before the lecture will start, and we don't want to compromise your attention to the speaker. So when we come in tomorrow morning by God's grace, after the welcome and everything, we will put the link for evaluation. So please, if you have done the pre-test, just put yes in the chat box. If you have been able to do it and complete, just write yes in the chat box. Just type in yes. Thank you. Please, OS, if you have been here before, it is very honorable to exit and talk about the issues of the last batch. Not on this platform, please. If you have been here before, if you have done this course before, please exit now. Program managers, please take note of this person. Olak Stephen. Please take note of him because it seems he has done this before and is jeopardizing other people's. Because he's asking about certificate and token. That is not the focus now.
That's not the reason why we are here today.
That is not the reason. People are just starting. You are asking about allowances and
people are even writing.
Professor Adejuma said that we are not sharing money.
Just distracting them.
Please stop distracting people. Just go. Just leave quietly. Thank you very much. We appreciate your participation in the last batch. We will sort all the issues, but please leave quietly so that the new set of people can enjoy their time. Thank you very much and God bless you. If you are yet to complete, please do that now. We have 4 minutes. Trying it, keep trying it. If it's not opening, please trying it. Just keep trying. It will open. People have done it and have submitted.
Hello, excuse me. I'm having an issue with the submission of the last page, the fingerprint.
Please type in the chat box. Your challenge will be attended to. Thank you. The class has not started. We are on pre-test. So if you are just joining, please click on the link for the pre-test and do your pre-test now. The link has been posted again and again. If you are having issues with the final page, you can log out and log in again. That may have to do with your network. In the next 3 minutes, we'll be calling on our speaker for today and we can start. But keep trying the pre-test in case you have not completed. You only have today to do it. And the best time is to do it before the lecture starts.
Sorry, if we're submitted, is when we see it, Mark Abby. If we're submitted, we see it marked, the script marked.
Mr. Aaron, please respond to the question asked. Will they see the scores at the end? Will they see their scores when they are submitted?
I think if they submit, they should be able to see their scores.
So
It's
make
possible,
sure that
it's
you
very
submit.
possible.
No, I
Most
wasn't
times, see
seeing
your
score,
score.
but I saw it marked. So
And it is submitted.
no,
It tells you
I didn't
submitted.
see submitted. That's why.
Can you screenshot what you have?
Okay.
We have only 1 minute to go. 1 minute.
Oh.
The link is opening. Keep trying it. It is opening.
Where am I going to send the screenshot then?
Put it. Put the screenshot on the chat box as well. You can upload the image.
I don't know how to do that. I'm not seeing where to. It's not showing me the chat box.
Somebody is saying, don't click on the fingerprint icon. Can you shift? Can you change location?
In that
If you are
instruction,
logged
you
out.
remember what happened the other time? Remember the other time after the pre-test and post-test, some people said they clicked on the fingerprint and they had problem. So somebody wrote on the chat box.
Click on the fingerprint icon.
Once they click on it, I think there's a technical.
Yeah, it just scatters the whole thing and takes you back to the beginning. If the site is not opening, it's 9 o'clock, please. I'm going to be calling on the speaker now. And all the issues with pre-test, just put it in the chat box, please.
I don't know how to post it there, but I've done it. It's showing me marked, but it's not showing me.
Please, can you mute now? Please mute everybody. Every issue that has to do with the pre-test should come into the chat box. Thank you very much for your time. Now we are going to be introducing Distinguished callers, ladies and gentlemen, please welcome with me our first speaker on the genetic counseling for sickle cell disease training program. That is in person of an erudite scholar, an expert in the field of hematology. That's talking about Dr. Hezekia Alkali Isa. Is an associate professor of hematology at the University of Abuja and an honorary consultant hematologist in the same university, teaching hospital, Gwagwalada. And so is affiliated to the Center of Excellence for Sickle Cell Disease Research and Training, and that is CESTRA of the University of Abuja. He is a member of the Nigerian Society for Hematology and Blood Transfusion. He's a member of College of Nigerian Pathologists and the Secretary of the Sickle Cell Support Society of Nigeria. Ladies and gentlemen, you will agree with me that we have a big fish in the house to talk to us about sickle cell disease, the epidemiology, the pathophysiology, the clinical manifestations of this disease that has become a public health burden in Africa, particularly in the west of Africa. Join me as we welcome Dr. Hezekia Isa as he takes the floor tonight to speak to us. Dr. Isa, please.
Good evening, everyone. Can I share my screen?
Please go ahead.
Go ahead,
Thank
sir.
you.
I've stopped sharing.
Okay. Can you see my screen now?
Yes, sir.
Yes,
Okay.
please.
So let me put it. So,
slideshow.
Yeah. So thank you for this opportunity again to be part of this batch of genetic counseling course. We will be talking about the overview, pathophysiology, and clinical features of sickle cell disease. So by way of introduction, sickle cell disease is the most common genetic disease worldwide. The clinical manifestations arise from the tendency of the hemoglobin to polymerize and deform red cells into their characteristic sickle shapes. That is why it is called sickle cell disease. As we'll see how that happens later. It results from the inheritance of two abnormal allelomorphic genes controlling the formation of the beta chain of hemoglobin. One of these abnormal genes must be the hemoglobin S gene. So we have here listed examples of sickle cell disease. This is not exhaustive. There are still more. These are the most common ones of clinical importance. We have the hemoglobin SS, which is also known as sickle cell anemia. Then we have hemoglobin SC, hemoglobin S beta thalassemia, hemoglobin SD Punjab, hemoglobin SO Arab, hemoglobin SE, and so on and so forth. So just as we've defined, you will see here under this hemoglobin variants, there is a common factor in all of them, the S. there must be a hemoglobin S gene with another abnormal allelomorphic genes to have a sickle cell disease. So the exception is hemoglobin AS. And why is it an exception? Because it is AS. Hemoglobin A is a normal hemoglobin. So it cannot be part of the sickle cell disease. So we have two abnormal allelomorphic genes in the beta chain, from both parents for us to have the sickle cell disease. So this diagram is giving us an illustration. I mentioned earlier that the homozygous form is also known as sickle cell anemia, and it is the most common type and the most severe form of sickle cell disease. So in the diagram by right-hand side, we have we have two parents. One is AA and the other one is AS. So, and we can see the possible offspring, the genotype that the offspring can have. They can give birth to an AA child. They can give birth to AS. They can also give birth to AA. So there are two possibilities here. So if I may ask, is there a sickle cell disease among the offspring? No, there is no sickle cell disease among the offspring because one of the parents has a normal hemoglobin. It does not have the sickle cell gene, which is also known as a sickle cell trait. So for the second case scenario is the diagram below. We have both parents. They are AS. They have the sickle cell trait. So for each pregnancy, they have a possibility of giving birth to 50% possibility of giving birth to an offspring with a sickle cell trait, that is AS, and then a 25% chance of giving birth to a normal offspring with hemoglobin AA, and 25% chance of giving birth to an offspring with a homozygous abnormality, that is the sickle cell anemia. So these are the possibilities. So there must be two abnormal sickle cell, the two abnormal genes or hemoglobins, one of which must be the hemoglobin S gene. So talking about the epidemiology, it is the most common genetic disorder globally with high incidence in Africa, India, and the Middle East. The sickle cell gene frequency varies from 15 to 25% in sub-Saharan Africa. In 2021, the global burden of disease study estimated that 7.74 million people were living with sickle cell disease, and projected that this number will continue to rise, especially in sub-Saharan Africa in the coming decades, if the right thing is not done to control the disease. So as I speak now, we are in 2025. The figures are more than this 7.74 million. The pathophysiology. Hemoglobin S arises from a mutation substituting thymine for adenine in the 6th codon of the beta chain gene. That is, the codon is supposed to have adenine that codes for for hemoglobin A, the GAG, and then that adenine is replaced by thymine, giving us guanine, thymine, guanine. If we look at the diagram on the right side, we will see the mutation. This occurs at the DNA level, and during transcription, it is translated in the RNA, and the building block now, as the globin chain is being built, instead of having the glutamic acid in the instead of coding for glutamic acid, it's now coding for valine, which is the mutant protein or mutant hemoglobin. And this will now give us the result into the various abnormality that we are going to be seeing. This mutated hemoglobin or abnormal hemoglobin polymerizes in hypoxic conditions, and it also undergoes marked decrease in solubility and increase in viscosity, forming a gel-like substances containing hemoglobin crystals, also known as tactoids. So we can see the chromosome in chromosome 11, and we can see the mutation here from GAG normal, which will give us a biconcave discoid red cell that is flexible and can meander through the tiny capillary vessels to supply oxygen to the tissues, whereas the mutated form will lead to polymerization of the hemoglobin to give us a sickle cell shape red cells that will get stuck when it reaches a tiny vasculature, especially under the oxygenated conditions. And this will, once it got stuck there, it will trigger a lot of events that will lead to several complications, as we will see later. So when there is the oxygenation, it depends on the severity and the duration of the deoxygenated state. When it is transient, even when the red cells sickle, they can reverse, the polymerization can reverse, if the deoxygenation state is not persistent. But when we have repeated and prolonged polymerization, it involves the membrane, and it results in the characteristic sickle cell shape, as we can see in this diagram. If there is delayed reversal of this polymerization, we can see how the hemoglobin is forming tactoids and is polymerized into strands, and this will sort of distort the shape of the membrane. It will, of the sickle cell, of the red cell, into a sickle shape. Sorry, I'm having challenge moving the slides. Hello, can you hear me?
Yes, sir. We can hear you, sir.
Yes, we can hear you.
I will
Yes, sir, we can
stop
hear you.
sharing and I will reshare because the slides are not moving. So I don't know, the slides are not moving. No.
But we can see your screen, sir.
Okay, you can see the screen. Yeah, okay, I don't know.
Also, I'm thinking if you can make it a PDF instead of a slide. We are having issue. You have a PDF version, can actually use it and be doing it page by page, sir.
Okay. So let me try that. Just give me a minute. Okay.
All right, sir.
Please go to the polls and fill in your attendance while we're waiting for the screen to be shared again.
Where is the poll?
Where is the poll now? Where is the poll?
Please send all your questions to the chat box. Please don't unmute again.
Go to the
Except
chat,
you're
you
asking.
see
Go to
the
the chat
instruction
box,
for the
drop in
attendance.
the instruction.
You see, look at everything you need is on the chat box.
Mr. Aaron.
Yeah, yeah, hello.
Are we good to go
Yes.
with the sharing? All right.
Yes, so if they can't see it, they can go to more, under, beneath their screen, they will see the various icons. They should hit on more. Then on that, you see various things popping up. Then you select polls or quiz. It will give you the opportunity to fill in your information.
Sorry, sir, but there's nothing like poll or quiz.
So what do you see?
Click on more.
I can only see settings, not
record, captions, documents, notes,
like
whiteboard, applications, and that's all. There's nothing like polls.
Dr. Riaku, please mute everybody except our speaker for tonight. Let everyone put their questions or concerns in the chat box. The instruction is Dr. Esther, maybe if we can't get the PDF immediately, you can still use your slides and don't put it on slideshow. Then we will plead with people to just zoom it so they can see it because of our time. Thank you very much, sir. Mrs. Joma or Mr. Aaron, can you share from your end?
Yeah, hello.
Hello.
Yes. Please, what do you say?
I'm asking if you can share it from your end. Can you share the screen for Dr. Isa?
Okay, then unless I switch my device.
Oh.
So maybe he can share it with me. I'll do it. I'll do that for him. And I'm sure everybody is filling the attendance form.
I want to believe so.
Yes, let me see. Yes, they are doing that. We have.
Please,
Okay,
how do you do it? Please, can you educate us
Please
how to
put
get
all
it?
your questions on the chat box. Please put all your questions on the chat box. You'll be attended to.
Yeah, so I think as of now we have 80 people out of 151. And yes, people are doing it. If you want to do it, on another simple way is, on the screen, you can see it something in the form of a bar chart or a histogram at the left top corner. You hit on it, it will give you opportunity to complete. I believe this will help all of us. So at the top left corner on your screen, we can all see, something in the form of either a bar chart or a histogram. You hit on that and then poll in progress, or it will give you opportunity to complete it. Please, can Dr. Isa share his document with me?
It's on our platform, Mr. Aaron.
Okay.
Well done, sirs and maths. It's not activating on my phone here.
Please put your questions and concerns in the chat box. Someone will attend to you.
All right, thank you.
Again, do it again and again. People have been feeling, and we are seeing as people are feeling it. Tyrone, do you have it now?
Yeah, so I'm downloading.
Siron, are you sharing? Thank you to everyone that has submitted the poll. Thank you very much. Others, please keep doing it. Keep trying and make sure you submit. If you have not done the pretest before, please do it. If you are joining newly, do the pretest and submit. Then fill in your attendance.
Hello, Dr. Niagu.
Yes, sir.
Hello.
I'm with you.
Yes.
I'm here.
Yeah. So, are you talking of the LOC page?
Yes, it's on the LOC page.
I think I can only see his profile.
Okay,
and
let me post it again. It was
okay.
Mr. Shulat that sent it earlier.
Okay.
Let me contact you. Dr. Issa, please, sir.
I've just
Hello,
rejoined. I've just rejoined now. Let me share.
Sorry about that.
Yeah. Let me.
Can you please send your slides to me?
Okay.
Let me hire you on WhatsApp. I'm also trying to look for it now.
Okay.
Oh, okay. I'm just saying that you are rebooting. We want to apologize for this technical glitch. Sometimes Murphy's Law just shows up with everything that has been done. But we are working on it now, and in the next few minutes, it will be rectified. I assure you that we won't spend more than the time we are supposed to spend.
So is my slide visible now?
Yes, sir.
Okay, so let's continue. I'm very sorry for this glitch. So we've seen how the hemoglobin polymerizes due to deoxygenation. There are other factors too that contribute to the pathophysiology of sickle cell disease. One of these is cellular hydration, the ability of the red cell to maintain its shape depends on so many biochemical factors. The red cell metabolism itself, the water content, the hydration of the red cell. So when the red cell hydration or the metabolic structure or function of the red cell is disrupted because of this mutant hemoglobin, we can have issues with the cellular hydration of the red cell. So there are many pathways that are involved in this. We have the calcium activated potassium channel, also known as the Gardner's pathway. There are about 100 to 150 of these channels per red cell. So hemoglobin S polymerization and cell cycling lead to a localized transient increase in calcium with the opening of the Gardner's channel, resulting in a large potassium loss with accompanying movement of calcium and water, thereby causing dehydration of the red cell. And this wasn't the state of the red cell, and also leads to sickling. The other biochemical pathway is the potassium chloride core transport system. The activity of this core transport pathway is prominent in erythrocytes and minimal in older red blood cells. It is markedly affected by the pH, and a decrease in 0.1 pH is sufficient to induce significant potassium loss via this pathway. That is acidity. When there is acidity, it can disrupt this pathway. However, erythrocyte magnesium content is an important modulator of the activity of this system. Increase in cell magnesium above the physiologic levels produces a marked decrease in the activity of potassium chloride core transport. So magnesium sort of buffer the calcium that is lost along with potassium, and also leading to loss of water. So we can see the diagram here on the right side. In the oxygenated state, all these channels are intact. There is no disruption. There is a metabolic balance. But when there is a polymerization, this lead to imbalance. We can see the potassium leaving the red cell, and along with water, chloride also leading to acidity. And if there's magnesium increase, it will sort of regulate the whole mechanism. Then there are other pathways involved in sickle cell dehydration. We have deoxygenation, included induced sodium and potassium pumps inhibited by dipyridamole. These are is the knowledge of these pathways, leads to discovery of therapies that are used in sickle cell disease management. Also, the oxidative damage of the cell membrane can also lead to potassium loss. So there is also another factor, the effect of nitric oxide. Nitric oxide plays a major role in vascular hemostasis. It is a critical regulator of basal and stress-mediated smooth muscle relaxation and vasomotor tone, endothelial adhesion, molecule expression, and platelet activation and aggregation. So nitric oxide play a role in all of this. So therefore, excessive cell-free hemoglobin after saturation of haptoglobin and hemopexin in the plasma result in the consumption of nitric oxide by hemoglobin-mediated nitric oxide scavenging. We know that red cells are easily hemolyzed. There's an ongoing hemolysis in the in the sickle red cells, and when they are hemolyzed, hemoglobin is released into the circulation, and this hemoglobin is usually taken up by haptoglobins. But when the hemolysis is excessive, the saturation of this haptoglobin and hemopexin, therefore leaving free hemoglobin floating in the vessels, and this can lead to scavenging of the nitric oxide that is released by the blood vessels. Nitric oxide causes vascular dilatation, relaxation, and when nitric oxide is deficient, there is vasoconstriction. So that is another factor. Then we have the cell-cell interaction in sickle cell disease. The genetic mutation in sickle cell disease leads to formation of sickle hemoglobin within the red blood cell and does not affect other cells like the white blood cells and platelets. There is, however, increasing evidence that there is indirect effect of this mutation on other cells, which may be important in the pathophysiology of sickle cell disease and probable explanation of the heterogeneity in patients with this disease. There is interaction between sickle red blood cells and the vascular endothelium, as well as platelets and leukocytes in activation of these cells. So this diagram is showing us how this interaction occurs. We can see the red cell here, and then this is the endothelium, and these are the factors like von Willebrand factor, vascular adhesion molecules, alpha-2, beta-3, CD33, all these cytokines or molecules that are involved in the pathophysiology, in cell-cell interaction or platelets aggregation and adhesion. So all this also contributes to the pathophysiology of sickle cell disease, can lead to sickling. Then the other factor is endothelial cell function, tissue factor expression, and nitric oxide production. We've already seen the role of nitric oxide as a vasodilator. So when it is scavenged, when it is depleted, there is vasoconstriction, and it can worsen the state of the sickle cell. So we can see these vessels here. This is a normal unobstructed blood vessel where there are both normal and sickle cells. But when there is hemolysis, there is increased reticulocytes, and these reticulocytes, they are sticky to the blood vessels. And when they stick to the blood vessels, they obstruct the flow. And as red cells are coming, they are jamming and aggregating on each other and further causing obstruction. That is what happens. And then we have hemostasis, red blood cell membrane changes. When there is a polymerization and distortion of the red cell membrane giving the sickle shape, the lipid bilayer membrane of the red cell, is distorted, and there is exposure of phosphatidylserine to the outside. So this can trigger coagulation. Then coagulant protein production, so that's tissue factor, and then decrease in protein C and protein S. All this can lead to activation of the coagulation pathway that can worsen the pathophysiology of sickle cell. And then we have platelets too. We mentioned about cell-cell interaction. So the platelets are activated, and they get stuck to the endothelium, and there's platelet adhesion, platelet aggregation, and so on and so forth. The coagulation pathway is activated. So here we can see the virtuous triad, which is very prominent in sickle cell disease. Inflammation that occurs both in the vessels, and the red cell itself, when the red cell membrane is distorted, can activate these three triads, these three factors: hypercoagulability, endothelial injury, due to the red sickle cell getting stuck to the red cell membrane, and getting stuck to the endothelium of the vessels. And then we have stasis too. We saw how the other cells are being trapped because of the vasoconstriction that is caused by nitric oxide depletion. So all this can trigger coagulation. So sickle cell disease is known as a procoagulant state. So all those factors that we've mentioned, from deoxygenation to the cellular hydration to cell-cell interaction to the procoagulant state of the disease, all these contribute in the pathophysiology of sickle cell disease that will ultimately lead to the various complications, whether acute or chronic complications. So this takes us to the clinical features of sickle cell disease. So the clinical features depend on the organ and system that is affected due to those pathophysiologic pathways that we just discussed. And sickle cell disease is known to affect all organ systems from head to toe, from the cerebral, from the central nervous system to cardiovascular, to pulmonary, to renal, and reproductive, genitourinary. All the systems are affected, and the signs and symptoms depend on the onset of these complications and the severity of these complications. So the acute complications, otherwise known as crisis, which is a sudden exacerbation of signs and symptoms, include vaso-occlusive crisis. There are three main types. We have the vaso-occlusive crisis, hemolytic crisis, though this is not really considered as a crisis, because the sickle cell disease itself is a hemolytic condition that is ongoing all the time, depending on the extent of hemolysis varies from one individual to the other. But there are situations that we have hyperhemolysis due to certain factors like blood transfusion and so on. Then the other one is sequestration crisis, aplastic crisis. So as I said, it depends on the complication, and the signs and symptoms depend on the complication. For vaso-occlusive crisis, the most common complications that we see are pain, depending on the organ or system that is affected. If it is in the bone, we have bone pain. If it is in the mesenteric vessels, we have acute abdomen. If it is in the chest, we have acute chest syndrome. If it's occurring in the penile In the penis, we have priapism and so on and so forth, but it's usually characterized by pain and sometimes swelling due to the inflammation. Then for the hemolytic component, we have jaundice, and patient can also have dark urine. Sequestration crisis is manifested by easy fatigue, pallor, tachycardia, rapidly enlarging splenomegaly. Very important. That is the main feature of sequestration crisis, and it's mostly seen in children. Then the other crisis is aplastic crisis. It leads to severe anemia, which is characterized by easy fatigue, pallor, headache, tachycardia, palpitations, and fever, depending on what is triggering the aplastic crisis. So we can see in this diagram all the complications, both acute and chronic. The yellow boxes represent acute complications, meningitis, stroke, post-hyphema, glaucoma, retinal infarction, acute chest syndrome. We have sickle hepatopathy, gallstones, septicemia. They predisposed to having sepsis because of autosplenectomy. Then we have papillary necrosis. There is renal acute complications, priapism, bone marrow infarction, and osteomyelitis. And the chronic complications are represented by the blue boxes. So we've seen for acute chest syndrome, the signs and symptoms include dyspnea, cough, and then when we do an X-ray, we find new infiltrate on chest X-ray, and there's also associated chest pain. For acute cerebral syndrome, patient will present with sudden severe headache, difficulty in speaking, loss of consciousness, neurological deficits, seizures, and so on. And then when the patient, usually in adults, when they have, or teenagers, when they have autosplenectomy, they are susceptible to fever and osteomyelitis and the infection by encapsulated bacteria like osteomyelitis, pneumonia, and so on and so forth. Then for priapism, it is characterized by unprovoked and prolonged sustained penile erections associated with pain and tenderness, and it could be recurrent. Then for chronic complications involving the central nervous system, we have retinopathy, visual defects, hearing defects, and seizures as sequelae of stroke. Then cardiopulmonary signs and symptoms when they have pulmonary hypertension, they include breathlessness, easy fatigue, palpitations, leg and ankle swelling, breathlessness and easy fatigue and palpitations, leg and ankle swelling, that is edema, and then they can have chest pain. For musculoskeletal complication, we have chronic osteomyelitis, leg ulcers, avascular necrosis of the bone, and nautopathy. We can see this lady, she has some degree of nautopathy. Clinical features. Other chronic complications in the GI, like the GIT with autosplenectomy, peptic ulcer disease, cholelithiasis, and so on. And for renal system, chronic renal complications include polyuria, nocturia, hypostenuria, that is inability to concentrate the urine, Then we have frequent urination, and sometimes they may have hematuria, whether microscopic or gross, depending on the stage. And they can have hypertension secondary to renal, chronic renal disease due to the repeated vasoocclusion. Then we have fatigue, pallor, facial or peripheral edema when there's end-stage renal failure. Then endocrine complications, usually due to ischemia in infarction on a chronic basis, or sometimes due to chronic blood transfusion, leading to deposition of iron on these organs. This can manifest as growth retardation and infertility, even diabetes when the pancreas is affected. So looking at laboratory investigation briefly, we'll see there is a lecture on laboratory investigation on diagnosis of sickle cell disease, but since we are talking about overview, we'll touch briefly on laboratory investigation. The laboratory investigation includes screening tests and definitive tests. One of the screening tests is peripheral blood findings. Usually when we do a blood film and we look at it at the morphology, we can see so many abnormalities in the red cells. We see the classical sickle shape cell as in this picture, sickle cell red cells. You see a lot of target cells and then a lot of polychromatic cells due to increased erythropoiesis, releasing immature red cells into circulation. And then usually the reticulocyte count will be high if we do reticulocyte count. Other features include target cells, I've mentioned this. And then if it is hemoglobin S beta thalassemia, we will see some degree of microcytosis on the blood film. Then the screening tests include sickling tests and solubility tests. These are screening tests and only suggest that there is hemoglobin S in the sample, including hemoglobin AS. So if even people with sickle cell trait, when we do sickling tests for them and solubility tests, it will turn out to be positive. And when we get a positive test, screening test, we go on to confirm using either hemoglobin electrophoresis at using at pH 8.4, using cellulose acetate or citrate agar at a pH of 6.2. Problem with hemoglobin electrophoresis is that it cannot make distinction between hemoglobin SS and hemoglobin S beta thalassemia. It is a qualitative test and it is affected by blood transfusion. Then we have isoelectric focusing. It uses a similar principle with electrophoresis, that is when hemoglobin is subjected to an electric field under a certain pH, the hemoglobins begin to migrate based on their net charge, whether it is negative or positive, and based on their molecular weight. They migrate at different rate to give us the different hemoglobins. That is the principle for hemoglobin electrophoresis and isoelectric focusing. Isoelectric focusing is also a qualitative test, and the challenge is the difficulty in interpreting it. It requires expertise and well-trained personnel to run it. Monoclonal antibodies can also be used, ELISA-based tests. And under this, we have the point-of-care tests that are used for screening, but they are quite sensitive and they can give us very good results. Example of this is hemotype SC sickle scan. They are example of this. And then they are based on antigen-antibody reaction, and they are qualitative. Then we have the high-performance liquid chromatography. It is quantitative in nature. It actually quantifies the hemoglobin present in percentage. It is used in newborn screening. We have the newborn variant type machine. Isoelectric focusing tool is used for newborn screening. Then we have the molecular test, polymerase chain reaction. It is DNA based, and it is usually used for research. And then when there is confounding factors, or when there is challenge using the other methods, polymerase chain reaction is used to decipher which hemoglobin type the individual has. So talking about treatment, usually is divided into stable state, managing the patient in stable state, and when they present with crisis or with complications. So this will depend on the type of crisis they are presenting with, or the type of complications they are presenting with, and which will be discussed later in due course. And of course, follow-up is very, very important. When they present with complications and they are managed, we continue follow-up. Follow-up also is important, even in steady state, to proactively, look out for these complications, and I detect them early and intervene early enough. So we have looked at an overview of sickle cell disease, looking at how it is inherited, the epidemiology, the pathophysiology, clinical signs and symptoms, and we touch briefly on the diagnosis and treatment. So thank you very much. God bless.
Thank you very much, Dr. Issa, for the wonderful presentation, despite the technical glitches that we have. Thank you for surmounting those and still giving us the very important points that we need to know in the overview of sickle cell disease, touching on the epidemiology, on the pathophysiology, the clinical manifestation, and on all the important things that you will still be talking about in details. Thank you very, very much, sir. I want to believe that everybody was able to follow you and to also move with you as you run through sickle cell disease in a nutshell. Thank you so much, sir. I can't see any question about what we have tonight. I'm sure by the time you come the second time, okay, there is a question now that I can see. Somebody is asking, what is the place of genetic modification in treating the disease? I'm sure it's going to emphasize on that when it takes the management of sickle cell disease in detail. The next time it comes to us, it's going to do that. So let's wait until that, until when it comes again. And so, sir, I can't see any other question here. I want to say thank you very much for what you have had tonight. The time is far gone. We're supposed to finish at 10. So I'm just going to rush over the housekeeping. Please remember that the pretest must be done today. If you are not able to do it, please keep trying it. It has to be done today, not tomorrow. And if you have not signed the I think everybody has signed the attendance from what I'm saying. And if you have not, please make sure that you sign the attendance today. It counts. And tomorrow again, by the grace of God, we will be meeting at 7 a.m. Nigerian time, 6 a.m. Ghanaian time, God willing. Thank you everyone that came in today, even if network was just acting up, but we were able to overcome it. That shows that we are victors in all our ways. So let's keep doing it. Let's go over what we've done today. It is just the beginning. There is more to come. And I bet you will not regret coming for this course. So tomorrow again, let's meet and make it a date. I don't know if program managers have any information to give us. Mr. Aaron, Madam Ijoma. Okay, in the absence of any other information, please let's take note that it is important to come in early. And when you come in, the moment the attendance is posted, we will let you know. Please, you need, from today now, you will have known how to access the attendance. Go to the posts and quizzes and more, and fill in your information and submit. It is important that you fill your attendance each time. All the 8 contacts that we'll be having virtually is important to the overall eligibility for the next step. Thank you very much, everyone. Thank you and God bless. Tomorrow is another day, and I pray that God gives us sweet night rest. Thank you and God bless. Thank you.
Amen. Good night, ma. Hello, ma.
Hello, ma. Mr. Aaron?
Yes, ma. Yes. No, right. Mr. Aaron. This is one of the attendee. Please, ma, for some of us that know WhatsApp, how can we get added to the WhatsApp group?
Oh, we will do that. We will do that. Okay. Please respond to the email that you have received. Respond to the email you have received so that we can, bring you over to the WhatsApp. Everybody eventually will come to the WhatsApp. Thank you very much.
Ma. Thank you, ma. Yes, ma.
All right, sir. Samas, have a good night. Thank you very much, sir. Dr. Issa, we appreciate you. I've sent you a message, sir. Please check.
Thank you very much for your time.
Thank you. And thank you all the LOC members. Dr. Kotila, I saw her. Thank you very much. Dr. Fakuni, thank you, sir. Mrs. Joma, thank you, ma. Dr. Riaku, thank you very much, ma.
Thank you, sir. Enjoy your lecture.
Okay, so we are ending the polls, the attendance. We hope everybody. We have 152.
I just hope everybody has filled it.
Yes, I think. I think so.
Okay, Dr. Nikum. Thank you, ma'am. Thank you, ma'am. God bless you. See you again tomorrow morning. Please, LOC, let us go to our platform. We'll have a little meeting before we end tonight. Thank you. Everyone, please go and have a little rest.
Please, can we have the link for the pretest? For some of us who have not done
it. It's on the chat box. Okay, I'm going to post it again.
Okay.
I'm going to post it again, and in the next few minutes, this meeting is going to be stopped. So please access it quickly. It's posted.
Okay, thank you.
You're welcome, ma'am.
Can we log out?
Yes, you can go.
Yes, please.
Thank you. Good night.
Thank you very much for staying to the end. Thank you. See you again tomorrow, bright and early.
Hello? Hello?
Yeah, yes.
Yeah, hello? Please, we wanted to find out those who couldn't enter today, how far? Are we out of the program or we are still intact?
Were you able to do the pre-test?
Not really. The network was too bad here. And as at now we speak, it's my wife on who was able to actually enter. She's a lab scientist and I'm public health officer, but I couldn't enter.
Please copy the pretest and make sure you do it before tomorrow.
All right. All right.
Copy
All right,
the
Mom.
link and make
Thank you
sure you
so
do it
much.
before tomorrow. You are in already. Did you fill
All right.
the attendance?
Please come again.
Did you fill the attendance?
Actually, I couldn't even enter at all.
Oh my.
I was expecting to do the registration, but unfortunately for me, I couldn't enter.
Okay, do the pretest. Let's see how it goes. But attendance is very important.
All right. So
And
I
now the
think
phones
tomorrow
are
we can
closed.
join around 7, right?
Are you are from Ghana, right?
Yes, please. I'm from Ghana.
6 a.m. in Ghana.
Ghana, 6 o'clock a.m.
All right.
But
right.
please,
7 in Nigeria.
in Ghana here it is 9:16. Please make sure you are able to submit the pre-test before, let's say 11 p.m. 11 p.m. Ghana time, because we would close it. So try as much as possible to submit it before you sleep.
Oh, okay. So once I wasn't able to enter, where am I going to get a pretest this thing?
On the chat box.
So the person, you are on a call and we have shared it over and over. So you can just pick the link.
Okay.
Copy the link now. Just copy it now and keep trying it before 11 p.m. Ghana time.
Okay. Please the link again. I'm watching. I wanted to copy
It's
now.
just pasted now.
I think it's gone. All
Go
right.
to the chat box. It is just
It's
pasted.
captured. Yes, please. It's
All
captured.
right. Thank you, everyone, and have a good night.
Thank you so much. Thank you. Bye.
What's he gonna say?
Hello, ma. Good evening, ma.
Hello.
Yes, ma. Sorry, ma. Please, I'm still finding it difficult to fill the attendance sheet. Hello.
Yes, hello.
Hello.
Yes, I can hear you. You can go
Please,
ahead.
I was saying I was finding it difficult to fill in the attendance sheet. So I don't know. Is it from my end? Because
Because it is, I don't know whether you have been able to locate polls stroke
I did not even
quizzes.
see it at all. All I saw here was charts, show captions, message settings, video statistics, help. That's all I saw from my end here. So nowhere I cannot even locate the polls and the quizzes.
It is like three fingers. The small one, the middle one, or like it's like a bar chart, right? So you hit on it. We have, I think almost everybody have submitted yes, based on the
Yes,
number of people that have
people too are saying
completed it.
they can't submit. So I don't know. And sorry, let me ask this. Unable to fill the attendance sheet tonight, does it mean you won't be able to participate again?
Yeah, you should be able to
Because I joined
submit.
from the beginning of the lecture and now I can't fill the attendance.
Have you been able to submit the pretest?
Yes, I have submitted.
Okay, no problem. If you are not able to do this, once you have been able to submit the pretest, I think it is okay.
All right, thank you, sir.
Yeah, but the attendance, it is the same way we'll be doing it for the next 4 weeks. So I think you should be able to be, on your screen at the top right corner, you should be able to see it.
What I saw here is leave meeting. The top right corner.
No, top left corner. The
Nothing
left corner.
is recording. Recording is what is showing, and you can't even press on the record.
So tap on this. You tap on the surface of your screen and see the icons that will be appearing. Whether in addition to the live meeting, there are other things.
Nothing.
I see.
Only the live meeting is there.
Only the live meeting.
Yes, if I try to click
And
on it, that means I'm leaving the meeting.
Okay. And then at the bottom too, you are not able to see either quiz
I
or
saw.
polls.
No, sir.
Okay, so mention the things you can see to me.
I
Mention
saw
them and let
chat.
me see.
The first one is chat. The second one is show captions. The third one is meeting settings. The fourth one is video statistics. The fifth one is help. And the sixth one is disconnect audio. That is all I can see from my end.
When you swipe to